My name's Don Kearney. I was born in Woodland, California. I joined the Marine Corps a week after my 17th birthday. I served in the Desert Warfare School at Marine Corps Base 29 Palms, and I went on to become an embassy guard at the State Department and served in the Middle East, Asia, and South America until I was discharged. After being honorably discharged from the Marine Corps, I used Vietnam veteran educational benefits to get my degree in international relations from the University of California at Chico. I went on to build and run a guide service for hunting and fishing. After that, I started a construction company that I built to 350 employees for over 22 years. In 2002, I was involved in a semi versus vehicle accident where I received catastrophic spinal injuries that resulted in tremendous pain. After my injuries, I had nothing but problems with my pain. I took medicine, I tried deep breathing exercises, massage, acupuncture, acupressure, and could not sleep. I had maybe an hour and a half of sleep a night. My spine surgery resulted in pain medicine. I went from Vicodin to fentanyl. I started out on one pill of Vicodin a day and got up to 125 mcgs of fentanyl. And I lost my company. At one of the myriad of visits to my pain doctor at Sacramento VA, I saw a yellow box on my doctor's desk. I asked what it was. She explained it was the Provant system, how it worked. I asked if I could try it. After using the Provant system, 30 minutes in the morning, 30 minutes in the evening, my pain levels dropped significantly. I was able to sleep throughout the night. My quality of life elevated. I was able to do it on my own without any doctor's visits or any special needles or pills, and my life has improved greatly ever since. After being on massive doses of pain medicine for over 40 years, utilizing the Provant system gave me my life back. It made it to where I could be a real person again and a parent and enjoy life with my children. It takes my pain away. I don't have to worry about how I'm going to feel the next minute or how I'm going to get through something or how many pain meds I have or any of it. I don't have to deal with a doctor. I just take the 30 minutes in the morning, 30 minutes in the evening, and I'm good for the day. And it carries with me throughout the day. And the night, I can sleep again. I can get up in the morning and enjoy my day. I'm not wincing and crying. If you don't give this a chance, you're not giving yourself a chance.
I grew up in Alexandria, Virginia, and I joined the United States Navy when I was 23 years old. Basically, I'd been floundering for a few years after high school, and I saw the Navy as an opportunity both to get an education and to do something positive serving my country. Stop and go traffic, 60 miles an hour. Suddenly, everyone had to come to a stop where the vehicle behind me did not stop. Rear-ended me, my car was crushed, my seat back was broke. It was quite a terrible accident. Osteoarthritis of the spine, that's chronic and degenerative. I've also fractured a T11 and T12 vertebrae. I'm diagnosed with degenerative disc disease, degenerative joint disease of the spine, and also radiculopathy in both my legs, which are, mean sometimes I can't move my legs because of the back injuries. And so since that day in 1993, for over 25 years, I've now been suffering and in a great deal of pain throughout. I was prescribed, painkillers to try and deal with that. Unfortunately, the side effect of the painkillers was that I became addicted to them and started combining alcohol with the painkillers as well, which led to a life of alcoholism and addiction. It's prescribed large amounts of anti-inflammatory meds, which is believed that may have caused me to be diagnosed with diverticulitis, ultimately leading to me having surgery to have part of my colon removed. So, the pain, the dependency, everything has just taken most of my life away from me during that time. My children were very young, so they missed out having a parent that could, play with them like the other kids' dad and swing them around and carrying them on their shoulders and things like that. And, my wife would always say, be careful with dad, he's got a bad back and things like that, and even today, my kids say that to my grandkids. I went from being extremely active. I played every sport imaginable to not being able to play any sports at all. My hobbies went from sports to, sitting around in front of the TV, playing video games, being depressed and thinking that life was not fulfilling anymore. I'm in the chronic pain management program at my local veterans hospital. And one day I was there receiving treatment from my neurologist pain management doctor. And she had told me that the people from Provant Regenesis were there in the hospital. And she told me a little bit about the machine and thought it might be something that I could benefit from. So she asked me if I'd like to try it out. And so I had nothing to lose. I still had the acute episodes and flare-ups, which leave me incapacitated and bedridden. When I received the Provant device, I began using it every morning and every night as prescribed. I felt immediate relief during the treatments. I'd have like a warming sensation. My pain would be reduced. I was able to fall asleep better at night. After 3 months, my pain level had gone down from a 10 to a 4. I was using the Provant in conjunction with the facet joint injections. 3 types of medicine that I take are meloxicam, duloxetine, and a gabapentin. I think that it's definitely benefited me, and then it's enabled me to keep moving. And then when I keep moving, I'm able to keep the pain levels lower. I do remember one specific time I went to visit my son in California. He's stationed out there in the Navy, and my grandchildren. And I didn't have the machine with me. I didn't take it with me to the airport. I could tell the difference during that 2 weeks away, not having the machine versus having the machine. And when I mentioned it to my Provant rep, sent the machine so I could have it when I was out of town so I could receive the treatment. And it definitely makes a difference. I'm now able to spend my time actually participating in life. I've been able to go back to college and earn my degree. I serve in a volunteer position as the president of a nonprofit organization. I'm also able to participate in all of the advised programs that the doctors at the VA have told me to do over the years, such as swimming and biking and walking and stretching and yoga and resistance training and all those numerous programs. If you're in pain, try the Provant. If it could work for me, it could work for you. And I'm extremely grateful. So thank you so much.
I've had over 43 years in the career path of nurse in some form or fashion. I've been a wound care specialist for at least 23 of those years. And I've worked acute care, I've worked primary care. I've been a family nurse practitioner for probably 13 years now, but I was a clinical nurse specialist before that, which is more inpatient focused. So I've seen a lot of people go through a lot of procedures and suffer a lot. And the primary modality has always been medication, and it's been opioids, it's been all of those sorts of drugs that we now are trying to get away from. And in fact, the last year of my practice has been in addiction medicine. So in that regard, I've seen the abject suffering that happens when people become addicted to these drugs, and after a fashion, they don't work anymore. In fact, it's counterproductive and they don't get the relief, but then they're dependent on the drug. My mother was a military, an Army nurse before they really even had Army nurses back in World War II. She did Army transport. So when my mom had told me all the stories about going to Germany and transporting troops and taking care of them, and they used to give her their patches. She had a whole pillowcase full of patches from China, Burma, India, and all the different units. And I thought, wow, and there's a story with each one of those. After learning about what she had done to help other people through her service, that was something I wanted to experience for myself. And I have to say, I don't regret it for a minute. I'd do it again. It's just priceless. When I was in the VA working there for 15 years, and as a nurse, you do a lot of repetitive tasks with your hands, especially as a wound care specialist. I'm doing debridements, I'm doing a lot of manipulation, compression wrapping, I'm looking at a lot of hands-on activity, not to mention all the endless typing that we have to do to record and document our visits. I developed carpal tunnel syndrome. Well, I developed it in both hands. I had surgery on the right, and that went well. It resolved, pain went away in about 6 or 7 weeks, but not the second one. And that's when I got into trouble. And that's when I had just driving pain. It was almost like somebody putting a railroad spike down the middle of my wrist. It was horrible. And we couldn't figure out why that was doing that. I couldn't sleep well. It was waking me up. And there was no explanation for it at the time. And I had to be honest with you, I'd been at the end of my rope in terms of I wasn't going to be able to take opioids, didn't want them, and I needed to work. So what was I going to do? Well, my days are long, and there was a great need to reach out and find something that would work. And so I had dialogue with your company as a provider, as a professional at the VA, because we have a number of people with chronic pain there, of course, and acute postoperative pain, like from amputations and such. And I had heard about the Provant system. And to be honest with you, I see myself as an evidence-based driven provider. I try and go by the research, and there wasn't a lot out there at the time for Provant. And to be honest with you, I was quite the skeptic, and I really didn't embrace it as a general use modality. I was going to wait for more research to be done, but I was desperate for finding some way to deal with this pain. So I started using the therapy, and at first I didn't really notice any marked difference, but over time the pain became less intense, and after a period of weeks, I don't recall exactly how many, but it was probably a couple, 3 anyway, it was noticeable, and eventually it resolved and did not return. Only thing I can pin it to is the system, because I had tried everything else. There were no other interventions that I tried for pain relief at that time. So when I was invited to speak to the FDA about my experiences with the technology, I described the course of my treatment, that nothing else had really proven effective, and that I found relief with it that I otherwise had not been able to achieve. My experience as a patient is say, yeah, look at this, because you may need less of the oral or IV pain medication. You may benefit from this. Please consider trying it, because it could save you the side effects and the trauma of severe pain. And I have to say, I recommend it when people come to me with a story of intractable pain and saying, if you can work it out, to consider it. I think that we need to definitely look at more modalities that help preclude the use of opioids. I've done a recent year in addiction medicine, and I can't tell you the kind of abject suffering people go through is just mind-boggling. And to watch people try and get loose off of the addiction of opioids is heartbreaking, to be quite honest. What we don't know, what we haven't experienced, it's basically nothing we're going to consider until somebody points it out and say, hey, this is an option, maybe to think about it, which is why I'm here today, which is why I'm talking to you today, because I believe that people need to have options. They need to be able to make informed choices. And the only way that that's going to happen is if we share information.
I'm Betty Clark, and I graduated from the University of Virginia almost 50 years ago. My first job was a staff nurse on a neuro-orthopedic surgical unit. Since then, I've held many rehab nursing positions throughout my long career. I even started a part-time business 20 years ago as a freelance rehabilitation educator. In 2016, I retired from my full-time hospital position. However, I do continue to teach the rehabilitation certification courses, which motivates me to learn the most current knowledge available to manage rehab treatments and modalities. One major responsibility of a rehab nurse is to manage the patient's pain level. This enables rehabilitation interventions and treatments to be more effective and can encourage the patient to achieve higher levels of independence and function. There are many options to utilize, but a long-term pain medication can lead to both drug tolerance and addiction. Pain management is constantly changing, and with the widespread opioid crisis, current treatments such as Provant have emerged as a non-drug device to decrease pain, swelling, and inflammation. Well, around 2000, I was diagnosed with osteoarthritis in both knees. I started with a knee brace and over-the-counter anti-inflammatory meds, but then eventually needed stronger meds. In 2008, my orthopedic surgeon suggested that I have surgery to clean up my left knee joint. During this time, I was a nursing educator in a large 1,000-bed hospital that covered 3 blocks. Now, my pedometer recorded thousands of steps each day. Eventually, I needed more relief as my left knee started to swell and my pain increased. And sometimes I even needed to use a scooter. We tried cortisone injections, but they really were not effective. So in 2012, I had my first knee replacement. Along with physical therapy, I used ice wraps, leg elevation, and a continuous passive motion machine. I returned to work in 8 weeks using a cane and was on light duty for another month. I continued PT after work for 6 more weeks as my mobility was not progressing no matter how hard I worked on my home program and with my PT. My quality of life was altered because my energy only lasted for work and therapy. So this meant limited outings and fun activities. Ultimately, I was pain-free in my left knee. However, my right knee was beginning to need attention. And yes, I knew I was headed for my second knee replacement. Three years later, my second knee replacement was scheduled. I was not looking forward to the work ahead of me. A few months before my surgery, I met a Regenesis representative at a rehab nursing conference where she was demonstrating the Provant. I chatted with her about my upcoming surgery, and she suggested that I speak to my surgeon about using it. It was delivered to my home on December 26th. It was like a belated Christmas gift. 4 days after my surgery, I actually started a home PT program. When my staples were removed 2 weeks post-op, my surgeon was so amazed at my suture line. No redness and only a moderate amount of lateral swelling, unlike my other knee 3 years before. I use Provant twice a day, along with my leg elevation, my ice wraps, and the continuous passive motion machine. Within 14 days, my pain went from an 8 out of 10 to a 0. There's sometimes I needed a low-dose pain med just before my therapy sessions to push my endurance to a higher level of degree inflection. By week 6, all of the swelling had disappeared. Throughout this recovery, the bruising was exceptionally light and did not travel down my calf as it did before. I returned to work in 6 weeks this time with only minimal restrictions, just a cane for a short period of time to provide better balance. I only required an additional 3 weeks of PT. Within just 2 months, my quality of life was back into full swing. I even was able to return to my freelance travel and taught a rehab class at Walter Reed Medical Center just 4 months post-op. My thanks goes to Provant. As a rehabilitation nurse educator, I have taught many modalities and interventions to enable patients to recover. I've even had my own recovery challenges with my knee replacement. Presently, I am the primary caregiver of my 90-year-old mother who's had recent neuro and orthopedic events. I have taught her how to use a rolling walker and to transfer into a shower chair. This type of care would not be possible unless I had full function of my knees. And even though it's been over 4.5 years since my last replacement, I am still very grateful for my mobility and my ability to care for her. My quality of life is still in full swing. I stay busy with my freelance educator work, dancing, being Mrs. Santa, and help raise funds for the local Florida veterans. What I learned during my journey is this: if you are a patient or clinician and need pain relief without opioids, consider Provant. I used it, it worked, and I would use it again.